Hey buddies, welcome back to DocDecoded. In this episode, we're going one level deeper into the why and how of IBS. Why does your gut act like it's having mood swings? And more importantly, how do we calm it down and get it back on your side? If you haven't checked out our previous episode on IBS, Irritable Bowel Syndrome, hit pause right here and go watch that first. Trust me, it'll make today's topic way easier to digest. Let's decode the science, the mystery, and yes, all in today's episode so that you can prevent and manage by yourself before starting medicines. That is IBS Part 2, Pathophysiology in Doctor's Word. What's happening inside the gut? Alright, so your gut looks fine on endoscopy, CT scan, ultrasound. Everything is normal, but you're bloated, constipated, or running to the loo after almost every meal or often remain constipated. So what's the deal? Let's break it down. IBS is what we call a functional disorder. That means are normal, but the function is not. Imagine a perfectly fine car engine that just doesn't start when you press the accelerator. Frustrating, right? That's your gut in IBS. So why does this happen? 1. Gut-brain axis dysfunction. Your brain and gut are like that dramatic couple who text each other all day. When communication's good, all's well. When it's off, chaos. The gut-brain axis is a two-way communication network connecting your central nervous system, the brain, and the enteric nervous system, the gut's own mini-brain. In IBS, this line gets glitchy. The messages between brain and gut get exaggerated or misinterpreted. So a small stretch in your intestine may feel like a big cramp, or mild gas feels like a thunderstorm in the tummy. Ever felt your stomach churn before an exam or interview? That's your brain-gut connection in action. In IBS, it's like that, but on repeat mode. 2. Abnormal gut motility. Normally, your gut muscles work in a smooth rhythm to move food along, like a well-trained orchestra. But in IBS, this rhythm can get a bit chaotic, sometimes too fast, sometimes too slow. When the gut is resting, things may look normal. But the moment you eat, boom, the colon starts overacting, especially in the rectosigmoid area. And this hyperactivity can last for hours after a meal. When doctors test by inflating small rectal balloons, both IBS-D and IBS-C patients show exaggerated and prolonged contractions. Basically, their gut says, "What's this invasion?" Could you recall what are IBS, C, D, or M? If you've not watched our last video, please check out. It will be easier for you to understand. In IBS-D, these contractions, called high amplitude propagating contractions, HAPCs, are stronger and more frequent, pushing things out too enthusiastically. In IBS-C, the movements are slower and uncoordinated. The gut's more like, I'll get there, eventually. So in short, the IBS gut isn't lazy or damaged. It's just moody and unpredictable. This irregular motility leads to constipation, diarrhea, or both. 3. Visceral hypersensitivity. People with IBS have guts that are a little too sensitive, like that friend who takes everything personally. Their intestines often overreact to normal sensations, a phenomenon called visceral hypersensitivity. Even mild stretching or gas in the intestine can feel painful or uncomfortable. It's like their gut alarm system has the volume turned way up. Food intolerance is also common, at least twice as frequent as in people without IBS. After eating, many experience postprandial pain, especially when food reaches the cecum, the first part of the large intestine. Interestingly, some feel better when fasting, because the gut finally gets a break from reacting to every bite. That's why many often avoid food while going out. But that should not be the right step. Ever wondered why your stomach cramps start right after eating? That's because of something called the gastrocolic reflex. Your stomach basically sends a message to your intestines saying, "Hey buddy, food incoming, make some space." In lab tests, when a rectal balloon is gently inflated, yes, that's actually a medical test, IBS patients feel discomfort at much lower volumes than others. It's not that their rectum is tighter, it's just that their nerves are more jumpy. Even lipids, fats, can trigger earlier sensations of gas and discomfort. So a cheesy pizza might feel more like a battlefield in the gut. But here's the twist. This extra sensitivity is limited to the gut's nerve pathways. The rest of the body doesn't overreact the same way, which means IBS is a selective drama queen, only in the stomach area. Scientists are still figuring out exactly why the gut nerves go into overdrive. But for now, we know that in IBS, the gut doesn't just feel, it feels deeply. 4. Central neural dysregulation. In IBS, the problem isn't just in the gut. The brain also joins the chaos. Brain scans, MRI, show that areas like the mid-cingulate cortex, which handle pain and attention, become overactive in IBS patients. This makes normal gut sensations feel extra unpleasant. Even the prefrontal lobe, which keeps us alert and aware, gets more active. Kind of like your brain is on high alert for every gurgle and cramp. 4. Gut microbiota imbalance. Yes, the famous gut bacteria, our microscopic roommates. Normally, your gut has billions of bacteria that help digestion and maintain a healthy gut lining. But in IBS, studies show there's dysbiosis, an imbalance in gut microbes. Too many bad bacteria or too few good ones can lead to gas, bloating, and irregular bowel movements. Sometimes this follows an infection. We call it post-infectious IBS. So if your tummy's never been the same after that one bad street food incident, now you know why. 5. Psychological factors. And let's not ignore stress. The ultimate trigger. Anxiety, depression, or chronic stress can worsen IBS symptoms through the brain-gut connection. So watch our last video to calm your mind and hence your gut. Because when you're stressed, your gut literally feels it. That's why doctors say IBS isn't all in your head. But your head definitely plays a role. Basically, your gut and brain are having communication issues. And you're the one suffering from their relationship drama. We'll discuss its management in the upcoming video. If you're finding this breakdown useful, hit that like button. It tells YouTube your gut loves this video. And don't forget to subscribe to DocDecoded for more science made simple.